Mayor Svante Myrick, members of the Common Council, and a number of City of Ithaca officials gathered at the Claremont Atrium on Tuesday evening to discuss key issues taking place in the Ithaca community, including Collegetown development, housing, and parking. The event was hosted by the Student Assembly City and Local Affairs Committee.
Because we have a rental vacancy of 0.5% citywide, 0.5%. It means 99.5% of all apartments are taken at any given time. That is absurd. You won't find that situation anywhere else in the country, even New York City.
That in the last 5 years, we've had almost $400 million of investment in the city. This is by private developers. And of course, that includes commercial space. So we have about 700,000 new square feet of commercial, and we have about over 1,000 new dwelling units in the last 5 years.
We do have, so 6 new projects in Collegetown, but we have new projects all throughout the city that are going to create a lot more housing. That housing, when you can hear the landlords, some landlords are starting to grumble and complain about it. But they're suddenly going to have to start competing for your business, which means either lowering their rents and keeping the rest of their apartments the same, or renovating their apartments in order to compete for those rents. That's our hope.
Myrick also elaborated on the Ithaca Plan, the city's new municipal drug policy.
For a long time, I've been aware of the fact that drugs are bad and can damage people and can damage families, but that the war on drugs, this $1 trillion effort that we've been waging since 1975, $1 trillion effort, that it locked up more people in this country than are locked up in any other country in the world. I'm not even talking about developed countries. I'm talking about any other country in the world that has locked up more of our ethnic minority than of any other country in the world. It has resulted in more black and brown men being under state control today than were slaves in the 1860s. And the Ithaca Plan asks us to reimagine addiction as a disease, a drug use, particularly addictive drug use, as a fast-moving river, if you'll forgive an extended metaphor here, a fast-moving river that people fall into, get swept up in, and will often lead to death, overdose. So we think of it as falling over that waterfall. And they said, well, what if we approach this in 4 sections? What if we talk about prevention? 4 different pillars: prevention, treatment, harm reduction, and law enforcement. Prevention. But the one that's been controversial, that's got us on CNN and NBC and the New York Times and all this stuff, is supervised injection. What is this idea? This is an idea that there should be a room in town folks who use drugs can walk into, sign in, sit down, use. In most cases, that means injecting heroin. If they overdose, a person on staff would save their life, and then they leave. Every time they leave, they have a conversation about treatment, a conversation about their housing, a conversation about their health overall. Why is this a good thing? There's four reasons. First, it saves lives. It just saves lives. Vancouver, where they've done this for 13 years, it's been used 2 million times. Not a single overdose death. It does 3 other things, though, that are good for us. First is it reduces public consumption. So you reduce public consumption, and the rate of crime around the supervised injection facility goes down. They found in Vancouver a 16-block radius around where they had the safe injection facility. Crime decreased across the board. Second, it reduces dramatically the rate of HIV and hepatitis transmission. These are diseases that should have been eradicated long ago. They are increasing in almost every county in New York State. More people each month are getting HIV in New York State because of IV use. When you go to a supervised injection facility, you receive clean equipment, and it reduces the rate of transmission. That's good for all of us because the cost on our public health care system is enormous. And finally, the 4th reason that you want a supervised injection facility is that it actually helps people get clean. People who use supervised injection in Canada are found to be 30% more likely to get clean and stay clean. We know that through public health campaigns, you can make an activity that is legal and allowed unpopular and unused. And that's what we have to do with heroin. Because it is illegal and popular. We are losing this war right now. I believe we can make it legal in the supervised injection centers and still have fewer and fewer people using it with prevention, treatment, and prevention.